Assalamu alaikum everyone. Bismillahirrahmanirrahim. Quote of the day: the roots of education are bitter, but the fruit is sweet. Aristotle. I am Dr. ALISHBA RASOOL, and today the topic of my presentation is chickenpox. I will be presenting it under the kind supervision of Professor Dr. Saira Afzal. Learning outlines: introduction, epidemiological triad, chain of transmission, clinical stages, levels of prevention, recent updates, and MCQs. Learning objective. At the end of this presentation, participants should be able to describe the epidemiological triad and prevention aspects of this infection, understand the factors that contribute to its spread and their prevention. Introduction. Chickenpox is a very contagious infection caused by the varicella zoster virus. Varicella is a Latin word used to tell the chickenpox shingles virus from its much more dangerous relative variola, which causes smallpox. Zoster is a part of the virus name because it is Greek word for griddle. Varicella zoster virus, which is a DNA virus that is a member of the herpes virus group after the primary infection. Varicella zoster virus stays in the body in the sensory nerve ganglia as a latent infection. Primary infection with varicella zoster virus causes varicella. Reactivation of the latent infection causes herpes shingles. Problem statement. Annual chickenpox disease burden includes 4.2 million severe complications leading to hospitalization and 4,200 deaths. In the pre-vaccine era, in developed countries, case fatality rate was about 3 per lakh cases compared to 1.3 per 1,000 measles cases. The incidence and severity of the herpes zoster increases with age, marked after 50 years due to decline in immunity. Adults who reach to 85 years, half would suffer at least from one episode of herpes zoster. Epidemiological determinants: agent, host, environment. Agent: varicella zoster virus, called human alpha herpes virus 3. Primary infection results in varicella chickenpox. Recurrent infection results in herpes zoster shingles. Host factors: age, children under 10 years of age, few escape until adulthood, can be severe in adults. Immunity: one attack gives durable immunity. Maternal antibody protects the infant for few months. No age is exempt in the absence of immunity. Immunoglobulin G antibodies persist for life and correlate with protection. Cell-mediated immunity is important in recovery. Pregnancy risk for fetus and neonate. Environmental factors: it shows a seasonal trend occurring mostly during the first 6 months of the year. Overcrowding: in temperate climates, there is little evidence of seasonal trend. Source of infection: usually a case of chickenpox. Virus present in oropharyngeal secretions and layers of skin and mucosa. Rarely may be a patient with herpes zoster. It can be isolated from the vesicular fluid during the first 3 days of illness. Infectivity: period of communicability 1 to 2 days before the appearance of rash and 4 to 5 days thereafter. It tends to die out before the pustular stage. Patient ceases to be infectious once the lesion have crusted. Secondary attack rate about 90% in household contacts. Transmission: droplet infection and droplet nuclei, face-to-face contact, portal of entry, respiratory tract. Virus extremely labile, so formites unlikely to transmit. Contact infection plays a significant role when an individual with herpes is an index case. Congenital varicella: it crosses the placental barrier and infects the fetus. Incubation period 10 to 21 days. Varicella pathogenesis: respiratory transmission of virus, replication in nasopharynx, regional lymph nodes, repeated episodes of viremia, multiple tissues including sensory ganglia infected during viremia. Clinical features may vary from a mild illness with only scattered lesions to severe febrile illness with widespread rash. Stages: pre-eruptive stage, eruptive stage. Pre-eruptive stage: onset is sudden with mild or moderate fever, pain in back, shivering, and malaise. Very brief stage lasting for 24 hours. In adults, more severe and lasts for 2 to 3 days before rash comes out. Eruptive stage: in children, rash is the often first sign. It comes on the day the fever starts. Distribution of rash: symmetrical rashes, centimetral distribution. A. First appear on the trunk, then face, arms, and legs. Mucosal surfaces generally involved. Axilla may be affected. Palms and soles usually not affected. Density of eruptions diminishes centrifugally. The rash advances quickly through the stages of macule, papule, vesicles, pustule, and scab. Pleomorphism, a characteristic feature of the rash in chickenpox. All stages of rash may be seen simultaneously at one time in the same area. This is due to appearing in successive crops for 4 to 5 days in the same area. Vesicles filled with clear fluid resembling dewdrops, superficial inside with easily ruptured walls and surrounded by an area of inflammation. Vesicles may form crust directly. Many lesions may abort. Scabbing begins 4 to 7 days after the rash appears. Fever not high by exacerbations with fresh crop. Diagnosis. Points for diagnosis: prodrome of low-grade fever, eruption of papules, vesicles, and pustule, typical dewdrop on rose petal appearance, characteristic centripetal distribution. Complication: it's a mild self-limiting disease. The mortality is less than 1% in uncomplicated cases. Patient at risk of complication are immunosuppressive patient, cancer patient, recipients of organ transplants, chemo, radiosteroid therapy patients, HIV infected, and children with leukemia. Shingles is a viral infection that causes a painful rash. Although shingles can occur anywhere on your body, it most often appears as a single stripe of blister that wraps around either the left or the right side of your torso. After you had chickenpox, the virus lies inactive in the nerve tissue near your spinal cord and brain. Years later, the virus may reactivate as shingles. Signs and symptoms: shingles usually affect only a small selection of one side of your body. These signs and symptoms may include pain, burning, numbness, or tingling, sensitivity to touch, a red rash that begins a few days after the pain, fluid-filled blisters that break open and crust over, itching. Transmission of shingles: a person with shingles can't pass shingles on to anyone else, but a person with shingles can pass on to the virus. The second person will develop chickenpox, not shingles. A person who has been vaccinated against chickenpox is protected from exposure to a person with active shingles. Congenital varicella syndrome results from maternal infection during pregnancy. Risk appears to be low, less than 2% period of risk through first 20 weeks of pregnancy. Varicella laboratory diagnosis: isolation of varicella virus from clinical specimen, rapid varicella virus identification using PCR, significant rise in varicella immunoglobulin G by any standard serological assay. Differential diagnosis: varicella exanthems, contact dermatitis, impetigo, insect bite, drug eruptions, smallpox, and other pox viruses. Difference between smallpox and chickenpox: distribution of smallpox rash and distribution of chickenpox rash. As you can see, it is centrally distributed. Smallpox 12 days incubation, chickenpox 15 days, prodrome severe and chickenpox mild. Distribution of red smallpox centrifugal and chickenpox centripetal. Palms and soles involved, and the palms and soles are not involved in chickenpox. Free of axilla extensor surfaces, axilla affected flexor surfaces. Characteristics of rash: in smallpox, it is deep-seated, multilocular, umbilicated, one stage at a time, no inflammation around the vesicles. While in chickenpox, it is superficial, unilocular, dewdrop, pleomorphic inflammation seen. Evolution of rash: slow and majestic, passing through definite stages of macule, papule, vesicule, and pustule. Chickenpox very rapid. Scabs 10 to 14 days, and in chickenpox, it scabs in 4 to 7 days. Fever subsides with appearance of rash, may rise again at the pustular stage. And chickenpox fever appears with each crop of fresh rash. Levels of prevention: primary, secondary, and tertiary. Reduction of risk factors before occurrence of disease, condition, or injuries. Secondary: early detection of the potential for development of a disease or condition or the existence of a disease while asymptomatic. Tertiary: treatment of an existing symptomatic disease process to ameliorate its effect or delay or prevent its progress. Primary prevention: health promotion and specific protection. Primary prevention of disease by ensuring high population immunity through immunization. Health promotion: how can you prevent chickenpox? Wash hands with soap, especially after visiting public places. Avoid direct contact with recently infected people. Use gloves and masks while taking care of people with chickenpox. Maintain a healthy lifestyle to boost your immunity levels. Vaccination: speak to your doctor. Specific protection like vaccines. Live attenuated vaccine in Japan, 1970s. Vaccine was licensed for use in US in March. First vaccine to reduce the risk of herpes zoster was licensed in May. Mild local reaction at inoculation site is 1%. Seroconversion in healthy seronegative children is over 90%. Vaccine: monovalent vaccine, 1 or 2 dose schedule, 0.5 ml subcutaneous injection. Duration of immunity probably 10 years. Immunoglobulin G levels are raised in blood to detect lifelong immunity. Varicella containing vaccines. Varicella vaccine Varivax, approved for persons 12 months and older. Measles and mumps, rubella, varicella vaccine, Proquad, approved for children 12 months to 12 years. Herpes zoster vaccine, Zostevax, approved for persons 60 years and older. Varicella vaccine recommendations for children: routine vaccination 12 to 15 months of age, routine second dose 4 to 6 years of age. Minimum interval between doses younger than 13 years of age is 3 months. Varicella vaccine recommendations, adolescents and adults, all persons 13 years of age and older without evidence of varicella immunity, 2 doses separated by at least 4 weeks. Don't repeat first dose because of extended interval between doses. MMRV vaccine approved for children 12 months through 12 years of age to age 13 years. Do not use for persons 13 years and older. May be used for both first and second doses of MMR and varicella vaccines. Minimum interval between doses is 3 months. Zoster vaccine and contraindications and precautions. Severe allergic reaction to a vaccine component or following a prior dose. Pregnancy or planned pregnancy within 4 weeks. Immunocompression from any cause. AIDS or other clinical manifestations of HIV infection. High-dose corticosteroid therapy. Secondary prevention of spread by the rapid investigation of close contacts to ensure their proper treatment. Prevention and control live attenuated vaccine in susceptible patients. Immunoglobulins. Prevention, varicella zoster immunoglobulin. Varicella zoster immunoglobulin given within 72 hours of exposure has been recommended for prevention. Dosage 1.25 to 5 ml intramuscularly. Used for immunosuppressed contacts of acute cases of newborn contacts. Provide improvement in high-risk children with varicella. Control. No specific treatment for chickenpox. Notification, isolation of cases for about 6 days after onset of rash, disinfection of articles soiled by nose and throat discharges. Antiviral drugs provide effective therapy for varicella, acyclovir, valacyclovir, famiciclovir, and foscarnet. Treatment, mild cases, children, calamine lotion, antihistamine. Severe cases, adults and HIV positive, acyclovir 800 mg 5 times in 7 to 10 days. Famiciclovir 250 mg TDS into 10 days. Others, topical antibacterial ointment like Mupricon to prevent secondary bacterial infection, antibiotic. Tertiary prevention of complications and deaths by early diagnosis and proper management. Recent updates. Cold antibody autoimmune hemolytic anemia following varicella infection. Autoimmune hemolytic anemia is a rare complication of chickenpox. In adults, such autoimmune hemolytic anemia is due to warm antibodies. We report a case of cold antibody autoimmune hemolytic anemia following chickenpox in a young female. Case report, a 24-year-old female presented with clinical and laboratory features consistent with hemolytic anemia 5 days after the onset of chickenpox. Her hemoglobin levels dropped rapidly during the course of admission from 7.9 to 3.8, with evidence of ongoing hemolysis in the form of rising total and indirect bilirubin. Peripheral smear revealed red cell agglutinates and erythrophagocytosis. Dead room test was positive for C3D, suggesting a cold antibody autoimmune hemolytic anemia. SIN test for donathin lancet antibody was negative, and all other tests for common causes of hemolytic anemia were non-contributory. It was presented to be due to chickenpox. The fulminant course necessitated a short course of oral steroids, to which she responded with a rise in hemoglobin and no further hemolysis. 2 weeks later, her peripheral smear was normal and DCT negative. Conclusion, in patient presenting with acute onset anemia following chickenpox, possibility of cold antibody autoimmune hemolytic anemia must be considered and appropriate testing pursued. Despite lack of empiric evidence, short courses of steroids may be beneficial if drop in hemoglobin is rapid, with evidence of fulminant hemolysis showing no abatement after first week. Platelet-poor plasma-based biofiller, an innovative alternative to expensive hyaluronic acid-based fillers for treatment of chickenpox scars. They are a challenge to treat because of the punched-out circular nature of the scar. These types of scars respond poorly to subcision. Injectable dermal fillers are a wonderful treatment modality for chickenpox scars with minimal adverse effects. The only disadvantage is the cost of the filler product and that it needs to be replaced every year or 6 months. Now it's time for the MCQs. Chickenpox is a very contagious infection caused by the varicella zoster virus. Very rarely a person can get exposed to the virus more than once. Once exposed to the infection, a person can develop chickenpox in as little as days. A first, B 6, D C 10, D 1 month, E 2 months. Anyone like to answer this?
C.
Yes, C is the right answer. Chickenpox illness usually lasts about 4 to 7 days. The classic symptom of chickenpox is a rash that turns into itchy, fluid-filled blisters. Which of the following is true for chickenpox infection? A. The incubation period is 5 days after exposure. B. Immune compromised children should be treated with acyclovir immediately after any exposure. C. Children develop immune protection following chickenpox but can develop the illness a further 2 or 3 times. Vaccination is recommended as a part of routine childhood immunization course in UK. E. The incubation period is 2 days after exposure.
B.
It's C. Children develop immune protection following chickenpox but can develop illness a further 2 or 3 times. A person has painful itchy area near his right shoulder. He has had chickenpox during an outbreak in past. After causing chickenpox, the varicella zoster virus can remain in the body for years before it causes shingles. Where in the body does the virus stays? A in the heart, B in the nerve cells, C in the skin cells, D in the lung cells, E in the liver cells.
B.
Yes, B is the right answer. Ali is having small groups of oozing fluid-filled blisters that appear a few days later in the area of pain and itching, also experiencing flu and fever. He was diagnosed as having shingles. When can a person with shingles pass shingles on to another person? A, never. B, just before the rash. C, while the rash is visible. D, when the fever is settled. E, after the rash is visible.
B.
A, never. Immunity to a disease is achieved when there are antibodies to that disease in a person's system. Presence of lifelong immunity that is achieved after infection is detected by high levels of which of the following? A, immunoglobulin G, B, immunoglobulin M, C, immunoglobulin E, D, immunoglobulin A, E, immunoglobulin D.
A.
Yes, A is the right answer. When a woman has chickenpox in the first 20 weeks of pregnancy, there is 1 in 50 chance for the baby to develop a site of birth defect. This is called congenital varicella syndrome. It can be acquired by A, direct contact, B, airborne transmission, C, fomites, D, vertical transmission, E, respiratory transmission.
D.
It's D, vertical transmission. A child presented to OPD with the complaints of high-grade fever, flu for the last 4 days, and rash was seen with blisters all over the body surface. On history taking, physician is asking multiple questions about the pattern of appearance of rash. Chickenpox rash appears at first axilla, B face, C arms, D trunks, or E legs.
D.
Yes, D is the right answer. Secondary prevention of spread of chickenpox is done by the rapid investigation of close contacts to ensure their proper treatment. Varicella zoster immunoglobulin levels are recommended to check after how much time in a confirmed case. A 24 hours, B 36, C 72, D 80, or E 1 week.
C.
Yes, C is the right answer. Varicella zoster immunoglobulin is made from blood and contains antibodies to the varicella zoster virus. This virus causes chickenpox and shingles. Most suitable recipient of varicella zoster immunoglobulin is A, a newborn baby, B, a pregnant female, C, a 14-year-old boy, D, a 60-year-old man, or E, a 2-year-old child.
D.
It's B, a pregnant female. A sterile lympholyzed preparation of the Oka-Merck strain of varicella zoster virus that can be used to prevent varicella, commonly known as chickenpox or herpes zoster, commonly known as shingles. This belongs to which group? A, live attenuated, B, heat killed, C, formalin killed, D, toxoid, E, immunoglobulins.
A.
Yes, A is the right answer. This is the key to the MCQs. Thank you very much for being patient and listening to my presentation. Okay, Allah Hafiz everyone.